A previous miscarriage doesn't mean you will not have a healthy pregnancy this time. Hi mommies, you're pregnant and you're going through some challenges which could be a sign of miscarriage. I know it's very heartbreaking, but then there are certain things we just can't avoid. You just have to be aware about these warning symptoms. What is miscarriage? A pregnancy loss before 20 weeks is called miscarriage. And this is very commonly seen only in the first trimester. Second trimester onwards, the risk reduces considerably. Many times a miscarriage happens and you don't even know about it. So sometimes you're confused whether it is periods or it is a miscarriage. And this is generally seen before the 8 weeks of pregnancy. If for some reason you haven't confirmed your pregnancy at 4 weeks, or if your periods are generally delayed, you get confused. So there are certain signs and symptoms in which you get confused whether it is normal pregnancy or if it is a miscarriage. In a miscarriage this early, you will feel certain altered things in your body because the physiology is changing. The signs and symptoms of pregnancy, your breast tightness, your nausea, vomiting will reduce, and you will have fluid discharge from your vagina. You might have heavier periods or maybe passing clots as well. Another thing that you will see is more of back pain and abdominal pain, and these are different from the menstrual cramps that you have. So this is early pregnancy loss without your knowledge. Now, if you have had any of these symptoms, please consult your doctor, even if you have little doubt, so that the pregnancy is confirmed, whether there was a pregnancy or there was no pregnancy and you just had delayed periods, because this will help us in treating you next time. So now let us have a look at miscarriages week-wise. Before 6 weeks of pregnancy, chances of miscarriages are very high as 10%. And this is very, very closely related to age. If your age is 35 years, there are 20% chances of you having a miscarriage, 40% chances of a miscarriage if you're around 40, 80% if you're 45 years or more. And 50% of these are seen because of chromosomal disorders, chromosomal anomalies. See, birds lay eggs and they normally lay 2 eggs. Have you ever seen any bird with 1 wing or 1 leg or 1 eye? It doesn't happen. They have a sixth sense. Whenever they feel that the egg quality is not good, they just discard it and throw it out of the nest. Likewise, if there are chromosomal anomalies, the nature will discard it and it will save you from having a deformed baby. Miscarriages after 12 weeks are less, but complications might occur. There are certain things which we can prevent and there are certain things which we can't prevent. So what all can be prevented? Direct trauma on your abdomen can be avoided. Exposure to radiation and chemicals is one thing that we can really manage. Drug abuse, alcohol, smoking, and taking too much of caffeine is also a cause of miscarriage. 2 or more miscarriages are a high-risk pregnancy and your doctor will treat you accordingly. Your weight, obesity or undernutrition, both are harmful for your baby. And certain chronic conditions, uncontrolled diabetes can also cause miscarriage. Now, what are the signs that you will be aware of? There could be spotting from the vagina. There could be frank bleeding as well. There could be a fluid discharge and cramps and pain in the back and in your lower abdomen. Now, when you visit your doctor, the doctor will confirm whether it is a normal pregnancy or there is a high risk or it is a miscarriage. And how do we doctors do it? We will do certain blood tests. We will examine you physically, and after 12 weeks, we normally see the funnel height. If it is less and the growth is not proper, we have certain doubts. In that condition, we'll do an ultrasound and confirm the well-being of the baby, and then the diagnosis of a miscarriage is done. Now, the recovery phase. You have gone through all this, lots of emotional turmoil and physical changes are happening. After your miscarriage, make sure you don't have intercourse for the first 2 weeks and don't use tampons because that could be a source of infection as well. Your normal periods will resume in 4 to 6 weeks. So just relax and just let that physiology take its own time. After your miscarriage also, you might have certain spotting for some time. Like in a normal delivery, we have bleeding for a month or 40 days. So even in a miscarriage, you might have little spotting for some time and some vaginal discharge also. Just be careful about the smell. If it doesn't have any foul odor, then that is considered normal. Now, when to plan for the next pregnancy? I will not say a time duration, but wait for your body to be absolutely physically normal and emotionally healthy as well. If you are going through a lot of emotional turmoil, I can understand what miscarriage does to so many of us. And each individual is different. Some take it very supportingly, some are very strong, but some of them become so emotionally weak. So before planning your next pregnancy, make sure you are emotionally healthy and physically healthy as well. Remember one thing, one miscarriage doesn't mean that you're going to have a miscarriage in another pregnancy. To remain stress-free and happy, please download our iMumz app and see the meditations in that so that you are happy, stress-free and healthy before your next pregnancy. Thank you and namaste.